Hi, my name is Dr.Misbah. I specialize in dermatology and cosmetic surgery. Today we're going to talk about liposuction and liposuction revision. Most doctors do not like to do revision cases. I like to do liposuction revision. It's complicated. It's very difficult to meet patients' expectations. For the most part, patients aren't really happy with the revision procedure because they have this idea that after the revision, the area is going to look like exactly like how they wanted it to be. And unfortunately, that's not always possible. Many times, we start the procedure and we try to reverse some of the defects that are as a result of a liposuction. And many times we're able to give them the results that they require and meet their expectations, but sometimes we are unable to. And that's mainly because sometimes liposuction leaves behind a lot of scar tissue. And scars are very hard to reverse completely. Sometimes they can be made better, but they cannot be completely erased. And that's where the problem lies whenever you do revision cases. It's also important to understand that the patient and the doctor have a great sense of communication and understanding as to what is realistically achievable in terms of the results. If the expectations are too high, then the patient can be a little dissatisfied with the outcome. Whenever I try to talk to patients about revising a certain kind of a procedure, I tell them that to expect at its best between 40 to 50% of the results. And when I say up to 40 to 50%, I'm undershooting it. To be honest, it's not like I only want to be good 50% of the time. It's just that many times when you go in and you start the procedure, you encounter certain problems that are not obvious at the time of consultation. And those types of defects are sometimes very hard to fix. Majority of the liposuction revision, it revolves around microsculpting, scar revision, fat grafting, and sometimes a little bit of a surgery is also involved. I break it down so that patients can understand that this is what the procedure entails. Sometimes the procedure can be done in one session, and sometimes multiple sessions are required. And this is also very important that the patients understand that. Sometimes we do all the sculpting and the fat grafting in one session and then have the patient come back and do additional work. Or sometimes we do surgery first, get rid of the scar tissue, and then have the patient come back and do the microsculpting and the fat grafting. Microsculpting in itself is an art. It's supposed to be done with a lot of meticulous attention to the details because there are areas where there are pockets of fat and then there are areas where there is actually no fat. So it has to be done with very small refined cannulas and preferably under local anesthesia so that you could see the results right there and then, and the patients can also see the results. Sometimes we take whatever fat we take out from the areas of microsculpting, we process it through different kinds of systems. The system that we use in our office is called PureGraft, and that gives us a very good yield of fat and very high yield of stem cells as well. We purify the fat and then we inject it into the defects. The part of the scar revision sometimes can be done as part of the same surgery, or it can also be done on a separate occasion. Some scars, they need to be excised, and that's what I mean when I say surgery. When the scar has to be cut out, then that procedure has to be timed it's very important to time that procedure, because if you don't, then the whole work that you did, it can all go to waste. So it's very important to time the surgery if it's going to be part of the liposuction revision procedure. Sometimes the surgery is done a few weeks in advance, sometimes it's done later on, but that depends upon your understanding with the doctor. Sometimes patients, they have had a number of liposuction procedures done and they also have had a few scars and there are areas of defects that cannot be revised. In those situations, I tell patients that the less is more, because we have so much scar tissue build up that it's probably not worth it to go back and do additional surgery. And as a doctor, I would like to say that it's important to tell the patients that when to say I don't think you should get more surgery. I don't think that it will make a difference for you. And it's very important to convey that message to the patient directly. In certain situations when it's just the appearance of the area, you could go with something as little as fillers. You could also just do some fat grafting, and that might be able to help. And I say fillers because they are the least of all in terms of complications, in terms of the recovery, and you can see the results right away. And if you don't like it, you can reverse them. And if you like them, you could always go back and add more. So we recommend that all of these aspects have to be discussed with the patient before we decide to go for the surgery, and then make sure all the questions are answered before we even start the procedure, and the patient has a clear understanding that there may be more than one procedure required along the line. And over time, if there is a need for a touch-up, then be prepared for it, because it's very hard to correct everything in one session, and it's also not realistic to expect that it will stay that way over a period of time.